And now News Channel 5 Investigates has discovered that Governor Bill Lee's team failed to heed key warning signs about what might be happening inside those prisons. Our chief investigative reporter Phil Williams has been analyzing the timeline, trying to figure out who knew what and when. Phil.
Rory, until last week, Governor Lee and his team had insisted that inmates could not be tested unless they showed symptoms. In other words, they had to get sick first. At the same time, they were warning the public that people without symptoms could still be infected and potentially spreading the virus.
All of us physicians sit around and say, how is this happening?
Last week, Governor Bill Lee's Health Commissioner Lisa Piercy expressed shock after testing at the Trousdale Turner Correctional Facility revealed a previously undetected outbreak of more than 1,200 COVID-19 cases, what was then the third largest in the country.
We don't know why, but we do know that the overwhelming majority of them are well. They're just testing positive. So from a scientific standpoint, it's a real head scratcher why they have such a high asymptomatic rate.
But go back to late March.
One of the most concerning trends we've seen is an increase in our elderly population, and specifically that at the Gallatin Center for Rehab and Healing.
After an outbreak forced an emergency evacuation of the Gallatin nursing home, Piercy issued guidance to all long-term care facilities, warning that, quote, recent experience suggests that a substantial proportion of residents could have COVID-19 detected without reporting symptoms or before symptoms develop. This was heard 2 days later.
There does appear to be a growing concern of pre-symptomatic spread, which means you can pass along the infection before you actually have symptoms.
And unfortunately, I think the call for testing should have happened long ago.
Hetty Weinberg heads the ACLU of Tennessee.
When you are locked up because the state has put you someplace and have locked you up, the state has a responsibility to provide the testing. The state has a responsibility to ensure that you have access to the health care you need.
In fact, there have been concerns going back to January about the virus rapidly spreading due to the fact that not everyone showed symptoms. On April 16th, News Channel 5 Investigates asked Piercy why inmates had to get sick before they could get tests.
You and the governor have both said people do not have to be symptomatic to get tests. But you're saying you're only testing inmates who are symptomatic.
I'd actually push back a little bit on, I don't think we've ever said that people that are asymptomatic or without symptoms should be tested.
But go back just one day.
Sometimes we know that people just don't feel right, or they might be what we call an asymptomatic or pre-symptomatic carrier.
Then, as concerns mounted about a massive outbreak at a state prison in Bledsoe County involving hundreds of confirmed cases, the commissioner seemed to acknowledge that cases had been overlooked.
We're learning that our prison population has a higher asymptomatic rate than we thought.
Still, it would be almost 2 weeks before the Lee administration ordered mass testing at all state prisons.
People are sentenced to prison, and that is part of our criminal justice system. But at the same time, it is not a death sentence and should not be a death sentence. And unfortunately, we're starting to see that.
So we went back to the health commissioner.
Do you accept any responsibility for the fact that this situation got so out of control inside the prison system?
Oh, I'm not sure anybody did anything wrong there. In fact, I think we are on the forefront of testing proactively.
Now, the ACLU had also urged the governor to make it possible for prisons to practice social distancing by releasing inmates who had less than a year to serve or those just in prison on technical parole violations. We discovered that inmate who died, convicted rapist Ronnie Johnson, was sent to back to prison in 2018 after he was found to be in possession of alcohol. Rory?